Good afternoon, everyone. I'd like to welcome everyone to School of Medicine Grand Rounds. I have the distinct pleasure today to introduce Ronn Johnson. Dr. Johnson is a professor of psychiatry and serves as the Associate Dean for Diversity and Inclusion here at our School of Medicine. Ronn is going to be presenting today on microaggressions in medicine. Ronn, it's all yours.
Thank you very much. I'm going to try to figure out how to make these slides advance for the presentation. I only have 3 slides, but my thought was that I was going to spend some time kind of walking through what microaggressions are, talk at you for about 40 minutes or so, and then open it up for any questions that you might have. The handout that you received or should have received kind of gives an overview of some of the topics that we're going to look at with respect to microaggressions in terms of medicine and the role that it plays in your work in medical settings. But I started out wanting to kind of get into something that sets the stage for all of the discussions related to not just microaggressions, but anything connected with diversity and inclusion. And that has to do with a tool that I've used quite a bit in some of my clinical work, both in group settings, but also in settings and working with industry, business, and with police specifically, and that is the use of the Jari Window. And the Jari Window was something that was created quite a while ago, and what it's used for is it's used to sort of help individuals gain the kind of self-awareness that's required in order to work in diverse settings. Now, I've used it in working in diverse settings, but I've also used it in terms of trying to help groups form correctly. And if you've got a copy of that Jari Window, it's an interpersonal model that's used to capture certain things that are connected with how people interact with one another and how a person interacts with themselves. It's used to as a framework for in business organizations and team situations where you can give an individual who knows you a copy of the Jari Window along with a series of statements, and then that individual uses those statements to evaluate you. And then as a result of getting that feedback from those individuals that know you, you achieve what's known as a 360-degree feedback. Recently, though, the Jari Window has been sort of morphed into something that's been used for just the purposes that we're talking about here today with respect to microaggressions. I want to spend just a few seconds talking you through the Jari Window so you kind of understand how it works, and it's a little bit more complicated than just the depiction of the 4 cells or 4 windows, as they're sometimes called. The first cell of the Jari Window is the cell that is used to describe yourself. Basically, it is the open cell. In other words, it's the cell that you feel no hesitation about talking about. Someone asks you what kind of car you drive, or they ask you what your favorite color is, you're more or less comfortable disclosing that information without any hesitation at all. It's known to you, and it's known to others. Cell 2 is a cell that is how you are perceived by others, but you cannot see it. It's the piece of lint that's on my jacket. It's other things about me that someone would notice, but I can't see those things. They're things that are formed by the impression of interacting with other individuals. The third cell is what's referred to often as the secret cell. And that secret cell represents those things that you know about yourself that are not known to others. There are things that you keep very close to your vest, and you don't readily provide that information, except maybe in situations where you have close contact with others that you really trust, and you might let them know what some of those secrets are. The other cell, or better known as the fourth cell, that fourth cell is the unconscious. And the unconscious, or the unconscious part of that cell, means that there are things that are not known to you and not known to others that basically can affect how you interact with others in some way. And as a clinical psychologist, the Jari Window can be used quite effectively in trying to get a quick assessment on what's going on with a group. And I've used it that way in terms of forming groups and trying to provide feedback to group individuals. Now, the cells, as they're depicted in the 4 cells that you probably have as a handout, are symmetrical. However, in reality, those cells are not symmetrical. So if an assessment is done on an individual using the Jari window, the size of those cells would change depending upon what is known about that individual. For example, you could have someone who has a very large open cell or cell 1, and that individual basically has what they see as no secrets. Their life is an open book. They talk about personal matters without any hesitation at all. So there are not a whole lot of secrets, not a lot of things that other people don't know about them, or they don't know about themselves, because they basically sort of live life in a very, very open way. The same thing could be true for cell 3. The cell 3 could be a huge cell where this individual has a lot of secrets. They're very self-contained. They're very staid in terms of how they come across. And sometimes what I do in illustrating this in presentations is I will have lines drawn through that cell to represent the levels of secrets that that individual has. And clinically, at least, when those cells are very big, this is an individual who basically has difficulty engaging others because they've got all of these secrets that are out there. So all these cells can vary in terms of their size depending upon the individual. Cell 4 is one of those too because of the, the unconscious elements of it, where it can also be very large. This person could have these massive sort of unknown aspects of themselves, unknown motivations behind some of their behaviors that significantly interfere with their ability to be productive. Now, if we took all of this information that I'm talking about here and we put it in the context of microaggressions, which is what I'd like you to do, the Jari window becomes an excellent tool for creating a framework for understanding how microaggressions play a role in terms of a person's way of coming across and being experienced by others. So by way of introduction, though, into this topic of microaggressions, each of you has a role to play in your work with diverse individuals in terms of parents, patients, staff, and other physicians that you might come into contact with. And so knowing yourself in those situations can be enhanced by understanding the role that that the Jari window could play in terms of giving you an understanding about that that aspect of yourself. So this means basically that in your role, you have a responsibility for trying to resolve conflicts. And so I believe that there are 3 constructs related to microaggressions that are very effective in helping to increase or enhance the capacity for being effective in those circumstances. So another way to look at this is, how can I be effective in a cross-cultural medical setting where I am constantly engaging people from different ethno-racial groups and gender differences, sexual orientations, disabilities, age, etc. And those are things that I have to be mindful of as I engage them. As a consequence of that, just by knowledge of how this works, one of those psychosocial constructs that affects how we interact, obviously, is microaggressions. And so microaggressions really, there are multiple definitions, and just one of those definitions could be, they are usually disguised insults that are designed oftentimes to disempower people of color or women and anyone that can be designated as the other. So with respect to the Jari window, being aware of how those things might manifest themselves through feedback from others will enhance a person's ability to gain control over those microaggressions and obviously change some of those unwanted behaviors. So probably one of the biggest challenges I think that folks experience is that they have to work in diverse settings and take on leadership roles. And the question often becomes one is, am I able to see myself in the situation and to modify, modify how I come across or understand how others might view me. So gaining some exposure to using this Jari window in that context, especially if you've got people that you trust, is a good way of sort of gaining the kind of insights that's necessary. Now, sometimes it gets a little tricky, and I have in the past had people, when they use this model approach, to give the Jari window to people who they don't know as well, and get those comments from those individuals too. And they use that as also a mechanism for understanding how others might see them. So the other part about looking at the Jari window and looking at microaggressions as a whole in this area of developing competencies necessary for working with diverse individuals, motivation plays a critical role. So the individual has to be motivated to examine some of these things, because if you've got this huge unknown area to yourself that's saying, or at least fueling the kinds of thoughts like, I don't have any issues in these areas, I'm perfectly fine, I engage in an appropriate way. Well, this is someone who basically is closed off to looking at some of the things that might play a role in how microaggressions manifest themselves in some direct way. So for me, I see that there's a nexus between several constructs that are related to self-awareness and the use of the Jari window, and how this person or any individual, whether in a clinical setting or even in a medical setting, could assume a leadership role and allow this window and the knowledge about microaggressions to affect how they engage diverse patients and colleagues. Unfortunately, I don't have enough time to talk about the research that supports some of the concepts that I'm going to be introducing, but I do have some other information related to this. If you want to contact me after this meeting, I'd be glad to share some of the empirical stuff that goes along with supporting this. But my interest in this has been piqued more recently in terms of the role as an Associate Dean of Diversity and Inclusion, because I come in contact with a lot of cases where individuals are reporting what they view as microaggressions that have been directed at them. And these are oftentimes females, students, administrators, residents, and faculty who have been exposed to these. So I want to just kind of highlight some of the things that typically occur, and particularly those related to gender microaggressions. So I like to start out in terms of trying to put some definition to this by recognizing that one of the things that I try to do, at least in working with these areas, is to approach it from one of three perspectives. And those perspectives are what I identify as pillars that I use for assessment and intervention. And those are things that you can also use too in terms of getting a handle on microaggressions, or even working with patients if you happen to be in the mental health field, to recognize the role that microaggressions might play. So there's research, and I've already talked about the idea that there are evidence-based basis for using these. But in my experience, the effectiveness of dealing with microaggression issues comes down to being responsive. So if someone gives me feedback that I've overstepped the line, or they confront me with something, I want to be, or made me aware of some issue connected with it, I want to be responsive, in tune with the diverse needs of the moment. So being in tune with the diverse needs of the moment means that I am being responsive, as opposed to immediately becoming reflexively defensive, which is not going to work into anyone's advantage under those circumstances. And then the other pillar, the third pillar, final pillar, is relationships. So am I oriented in dealing with others that allows connections to be made with them? And I have seen these things occur in my own experience, and I get obviously reports about this because of the role that I play in having to respond to some of these issues, or in guiding other people in terms of how they might respond to these situations. But there's a considerable amount of research on microaggressions, which reveals how common problem it is in multiple settings, not just in medicine. I've seen it in policing, I've seen it in business environments. So it's something that is prevalent. I want to give you an example of just how that works. There's a female faculty member who was applying for a position, and she had a face-to-face interview as a candidate. Dr. Maria Vasquez, she had, I changed her name obviously, but she has dark hair, dark eyes, and a tan complexion. And most of the committee members assumed that Dr. Vasquez was Latinx. So one of the members of the search committee posed what they thought, I think, was a ice-breaking question. Where are you from? Dr. Vasquez responds, Minneapolis. Another search committee, not satisfied with her answer, follows up with, no, I mean, where do you come from originally? And Dr. Vasquez, obviously unsettled by this, repeats the response with an edge in her voice, Minneapolis, you know. But this is an example of a microaggression. And I've seen this myself in meetings, and in fact, meetings becomes the forum where microaggressions are more likely to occur, because during those interactions, during meetings, things get said, there's a back and forth exchange occurring sometimes. I actually had a colleague, I was in a meeting and sitting next to her, and most of the people in the room were males. She made a comment. As she was making her comment, no one looked at her. I looked at her because I'm sitting right next to her, and so I'm listening to what she has to say. And basically her comment goes unacknowledged by the group. Not more than 10 minutes later, a male in that same meeting makes almost exactly the same comment about whatever the topic was at that moment. Everyone's looking, giving him full attention, and approving through head nods and other comments related to that, his response to whatever the topic was being discussed. Another example of microaggressions. I had one of the most common concerns that comes up with medical students that I see that bring things to my attention. One example, but it parallels, it's similar to other cases that come up to my attention closer to home, where a student makes a comment, or professor, I should say, makes a comment in a class and says this topic that they're talking about, some character that they're examining in the course, he says, it looks Chinese, and then laughs out loud about it. And the only Chinese student, a female student in the class, is there, and obviously feeling uncomfortable about this, but politely smiles even though she feels uncomfortable. But the professor continues making comments about this character that he views as being Chinese, laughs about it more. Other students start laughing about it, and the female student in that situation feels disempowered, ashamed, and humiliated by the experiences. But all of these are examples of what could be described as gender microaggressions, and some, because of the racial overtones, so this could be described as racial microaggressions. But gender microaggressions are defined as small, seemingly innocuous comments that pile up over time and affect a person's sense of self and identity as it relates to their gender. Gender microaggressions are like the everyday insults and indignities, demeaning messages sent from females by well-intentioned males who are unaware of the hidden messages being sent. So these microaggressions can become commonplace that we don't even notice them, okay? And microaggressions, though, the way I look at it and the way other people experience them, is really a form of bias. It's a bias intimidation. It's a form of harassment. So as in so many things, really the microaggressions, or the concept of microaggressions, started back in the 1970s. Charles Pierce, a psychiatrist at Harvard, was the one who originally coined that term because of his contact with patients, where he heard about or even witnessed things that were regularly being exposed to African Americans, and coined the term microaggressions. Daryl Sue, who some of you might have known, another psychologist, really sort of took it from there and did a lot of the research that supports this concept in the literature. But they are a formidable issue in institutions. So when you're trying to address issues of institutional or systemic racism, use and understanding of microaggressions, for me, serves as the foundation for trying to change or modify or get a culture to become more in line with what you'd like it to be. And that is a culture where there can be conversations about microaggressions done in a very respectful way to kind of bring about a need to modify that behavior in some way. So that's kind of how I'm looking at it. I want to also let you know too, and particularly in this topic, that I'm starting to try to collect examples of scenarios related to microaggressions that I can use to kind of showcase this. So if you have stories or examples of those, I would welcome those, so you can send those to me via email. But the larger question sometimes is, how do I navigate around microaggressions, and particularly gender microaggressions? And so I think probably the most direct way to do it is to call it out what it is immediately when a person is exposed to it. So because these microaggressions can be both verbal and nonverbal behaviors that communicate some kind of a negative intent to the person who is the recipient of it. And they often are derogatory messages that are rooted in putting down or marginalizing members of a particular group based on either their gender, their race, their ethnicity, their sexuality. There could be other groups included into age, disability could be included in that group as well. But all of them collectively can be characterized as being the other. And that's what we're kind of getting at here. So usually the microaggressions are unintentional, but they're rude statements that are directed toward people who are usually stigmatized because of some characteristic that they can be discriminated against. And that's how it works. And so there are some critics that say that maybe this term should be changed to be more in line with a perceived racial or gender slight, but I don't know if that's going to ever get any kind of traction at all as an area to look at. But essentially, the individuals exposed to these things, there's a form of what I would describe as a kind of a micro invalidation of some kind, such as being told in a negative interaction could have been due to that person's racial motives, or micro insults, such as a teacher avoiding calling on someone in a classroom or something like this. So these are examples of how the microaggressions, micro invalidations could be done in that way, achieved in that way. And so the other thing that can be done, at least when I go back to looking at how none of this really is new. The concepts or the areas in psychology where this has been most popular deals with assertion training. And I used to do a lot of assertion training in the past. And so one of the rules of assertiveness is you do not allow anyone to put you in a one down position. And so being assertive means you would stand up in that situation because they can say and do other things that will sort of disrespect you. So the thing to do under those circumstances is not allow yourself psychologically to be placed in a one down positions. But I will say too, and you probably have noticed this from your own experience, or at least observed it casually, that microaggressions really, they can occur in everyday interactions. They can be intentional, unintentional, and they often go unacknowledged. But the ones that that I think are most disturbing, at least from the comments and reports that I get, are those with gender microaggressions. And so you get someone who might try to sexually objectify females. I love films, and so one of my favorite films is the film Wonder Woman. Okay, and so I watched the new version of that film a couple of weeks ago, and then I read a review that really was a very scathing review of the woman, the actress that plays Wonder Woman. They had used her in a men's magazine in Israel to recruit Israeli soldiers. And so the underlying message is that the only way that they could theoretically recruit male soldiers was to use, obviously, this attractive female as a way of sort of recruiting them. But it's an example, some would say, of sexual objectification. Other ways in which gender microaggressions can occur is this whole idea of putting someone in a second-class citizen status just by the comments that are being made, or the overuse of sexist language, assuming that this person doesn't know, or assuming inferiority because of that person's gender, or making some kind of effort to restrict someone's functioning strictly based on gender is another thing. Then when confronted with this as being sexist behavior, the person denies it. So there's a denial of the reality of sexism, even though it may be quite apparent, quite visible in some way. Denial of individual sexism. So you get a person that puts up their hands and says, no, that's not who I am. That's not what I do. Other things that happened related to this is this old idea, and I think the example I gave earlier about the colleague in the meeting who was basically ignored, this whole idea of an invisibility. They don't see these individuals, and so that becomes a concern. There can be sexual humor or jokes that are thrown out. Then you can have something that happens quite frequently. It's more the what I would describe as kind of an environmental or system-wide invalidation. Here, this is what I would be at more kind of a macro aggression that happens more on a systemic basis. For example, you could have females that are, when they look at the pay equity issues, that the pay is different, or there could be some kind of artificial glass ceiling that is present and known about. So going back to navigating the microaggressions when they occur or they are experienced would be on an individual level. You certainly want to confront it. And I would say, because I have done this before, what you said and what you did is a good example of a microaggression. I just want to bring that to your attention. And I realize in saying that there could be situations where you find yourself where there's a power differential between yourself and the person that you're talking with, but generally that approach is one that I think is important to try. The other thing too, as a goal, systemically speaking, is to try to create a culture, a climate overall where that is a possibility, where that kind of behavior, that kind of professional confrontation is acceptable and reasonable. And the other thing to think about, at least in those situations where you confront that individual, is you can assume that if that person did this to you, they've probably done that over many times in the past, and you're just the first person that brings it to their attention in some way. And so there's value to be connected with what you do. So I also would encourage, and I try to do, and it's a never-ending search for myself in this area, to become aware of my biases and stereotypes and prejudices that I might have. The other thing that a person could do in relation to this one situation to kind of chronicle it in some way is to tell other people about your experience, so that you get the support from those individuals who might also be aware of what's going on. I also say become an ally and an activist. And this is something that is very important. If we're going to modify and change the culture in medical settings related to this, there have to be a group of allies, though small sometimes, that forms around the topic of microaggressions and other things that undermine the worth and dignity of individuals. And this is a way of sort of at an organizational level trying to change the culture that basically allows this kind of behavior to occur. Organizationally too, we have to look at policies and practices and procedures that allow for, or at least promote, equal access and opportunity. We want to try to create a welcoming climate. When you think of the word inclusion with diversity and inclusion, the inclusion part means that well, diversity really is just, you invite someone to go to a dance. The inclusion part means you invite them to dance when they come there. And so you're going to change the organizational culture. It has to be one where people are invited to dance. So there are a lot of professional opportunities out there to look at that will help enhance skills in that area. There could also be ways in which education, mass media, other things that happen at the institution could be used to do that. So policies have to be modified, obviously, to promote equal access. Access to trainings related to diversity and inclusion are very important. one of the things that somehow gets lost in the shuffle of all of this related to diversity and inclusion, specifically as it relates to microaggressions, is this idea of motivation. And motivation means that there is a connection between microaggressions, self-awareness, and motivation to change. So if an individual is unmotivated, unwilling to look at some of these issues and areas, then the likelihood that they're going to change major aspects of themselves and this way of functioning is going to be minimal. So a large logical question to ask under those circumstances is, do you really want to enhance your relationships with others? And so in order to accomplish that, that means something. And so that means there has to be a motivation on your part to understand yourself in relation to others, which is critical for working with things like multiple microaggressions and also achieving the kind of, I guess you would call it cross-cultural competencies that people claim that they embrace for if they're in specifically if they're in a leadership position or in clinical practice, because when you work with patients, the same thing applies. So the Jari Window, I think, has been helpful, at least in terms of trying to gain the kind of skills necessary for that. And so looking at the cells, and you start putting in place things that people might say about you in relation to microaggressions, I think would be a very good way to start that dialogue. You can also look at yourself individually without taking on the full burden of allowing someone else to do that for you. So I would strongly encourage you to start gathering a small group of people, 2 or 3 people, using some of those descriptors that are common with that, and getting feedback, particularly in those blind areas, particularly if I'm interested in knowing how I engage diverse individuals, or I engage the issues of diversity and inclusion, particularly as it relates to microaggressions, would be very helpful in turning some of those things around. So the question that you raise in those situations, or I raise with myself and others that I work with in this area, is, do I want to become more effective and productive in diverse situations? So if that's true, then I have to develop better self-awareness in these areas, which means that I have to confront things that may not be in my understanding. The other thing I have to get past too is I'm well-intentioned, and I might think in my own head or convince myself, and some would say this is being self-delusional, that you're okay, that you have sort of gained the level of competence that you need in this area, and your motives are pure and well-intentioned. But nonetheless, you can also be guilty of not making the most appropriate decisions in situations where you're dealing with diverse patients or diverse colleagues, which creates a problem. So I have to be open to considering that as a possibility. And some of us may not be as open, which is why the Jari Window is used, to get that feedback, to receiving that kind of information and then using it in some way to modify some of the thoughts and feelings that we may have about diversity, equity, and inclusion as it applies to microaggression. So in addition to that, there's the psychological mindset, the motivation to do it, and then what kind of skills do I need to have related to this? In some institutions, they actually send out lists of examples of microaggressions, in order to sort of increase the level of understanding about what some of those are. But then that list is obviously not going to cover everything. It's not exhaustive. It doesn't cover everything, but it gives you some idea. The other thing I like about that idea of sending out the list is it gives people who are in the positions of being the other an opportunity to be heard under those circumstances, so people can gain the kind of competencies necessary for working in those situations. So I always ask that question of, what do you think about yourself and your behaviors, and how do others see you in your behaviors when it comes to issues of diversity and inclusion, and specifically the use or overuse of microaggressions? So what do you think about yourself that could be completely different from how others see you? So in your head, in my head, I would say that I have convinced myself that I'm a certain way, but yet that's not how I'm being perceived. Some of you that have had contact with me know, you know that I'm 6'5", but in my own head, I see myself as being 5'10". But when I look at myself in pictures, it's like, whoa, I'm taller than most of the people I come in contact with. So that perception is different in terms of who's doing the perceiving, I guess. So I would just say that the Jari Window can be very helpful in that process, and it can provide a lot of useful information because it allows you to get, if it's done properly, into that blind spot, which really can be fun and threatening at the same time. But that awareness is going to be very important when it comes to getting a handle on the microaggressions. The other thing too that's important with this process, I talked about earlier, the 360-degree feedback. Well, that feedback gives you a more complete picture because the individuals, if you get enough of them, 3, 4, or 5 people, you can get a pretty good picture of yourself, but you have to be in a position where you can accept that feedback and not get into an argument about the accuracy of the observations that are being offered at that time. So the big thing with the use of this approach is you have to be comfortable asking for feedback, and then you also have to be comfortable with receiving the feedback, even though the feedback may be incompatible with your own view of yourself under those circumstances. But that feedback is essential for self-awareness, and it helps you learn how to discover how to communicate or perform in a more effective, productive way in diverse settings. So one of the shifts in the climate and the culture here would be, in any medical setting, would be to seek feedback and never be afraid of asking feedback from others. So you don't know what you don't know about yourself, so that feedback is important, and I look at it as a very critical ingredient to self-awareness, and it helps you to move into a new arena. And so that's why it's so important. And when we start thinking about particularly microaggressions and how its origin started with the observations of Dr. Pierce with respect to the experience of African Americans, racism is probably the most ubiquitous experience for diverse groups. And there's a history in medicine, and medicine's history is littered with it. So in order to bring about some kind of inclusive culture, there are fundamental things that all the stakeholders must do and gain, the kinds of cultural competencies, I guess if you want to call it that, and that Jari Window becomes one mechanism or tool that can be used for the purpose of developing those skills. So we know that healthcare systems can be cultures of microaggressions where it's tolerated to some extent and promoted in some way. So I would say that we just continue moving forward with this and making it happen. So I wanted to stop right about now, and I think it's about 15 of, if I'm judging it correctly, and ask for questions.
Dr. Johnson, this is Marcus Balters.
Hey, Marcus, how are you?
I'm good. Thanks for the talk. I guess the question I had was, and maybe I missed it, did you give us some questions to ask, have people ask? Like if you do this sort of 360 evaluation, is there a list of questions you should ask?
I didn't send that, but I can, Marcus. There is a list of like descriptors that they've used in the past. Where's my screen not showing my face? I don't know why that's happening. Can't get that out of there. Okay, there we go. There's a list of descriptors that are out there. I can send you a copy of those if you'd like. Just send me an email to just prompt me to do it. But those descriptors are used as prompts to get people to be able to give you feedback. Now, and it's very helpful, okay? Especially if you can do it. I like to do it in 2 ways. You can pick maybe 4 or 5 people, and you pick some people that you know really well, but then you also pick some people that don't know you as well. and ask them for feedback. And again, it's not for the purpose of defending yourself or trying to explain yourself, but to get feedback in terms of how people who know you well see you, but also maybe how people who don't know you as well, but they have their own impressions about you. So what it does is getting that information helps you kind of modify some of the things about yourself that would be problematic in your interactions, particularly if you're in a position of leadership. It would be great to get that, and also be great to get that for other people that are working with you as well.
Thank you.
Sure.
Hey, Ron, there's a question on chat from Kevin Embach. His question is, does the concept of human dignity, that every person is created in the image and likeness of God, helpful in this conversation?
Wow. Absolutely. And that's the whole idea, I would think, behind that is to create that sense of dignity. Yes, we are creatures of God that he created, and that's a very important concept of this. But I don't feel qualified to quite go into the detailed discussion about that. But the general answer is yes, dignity plays a very important role. In fact, when you start thinking about microaggressions, it's designed to promote just that, dignity with people. And so, yes, absolutely.
There's another question on the chat from Joanne Porter. Are there examples of microaggressions that physicians may deliver to patients? That is a hard group to get feedback from or to modify our blind spots.
Wow. Well, if you had patients that, how would I do it if I was going to be in that situation? If you have patients that you work with on a regular basis, that you have some kind of rapport with, this would be one way to get some of that information from them if you feel comfortable doing that. Not everyone has the, what's the word I want to use? The ego strength, I guess you could call it, to put yourself in a situation where you're going to get that kind of feedback voluntarily from patients. But that's one way of doing it, would be to give them the tool, explain it to them, and ask for their feedback. And I think that would be a very helpful thing. The next step would be, then what do you do with that information when you get it? Do you have the capacity to modify some of those things about yourself if they are sort of interfering with your ability to connect with some of your patients?
Okay. There is a bunch of questions coming up on chat here. Ron, do you have access to your chat?
I see things coming up, but Michael, it's beyond my skill set to do more than one thing at a time. So
okay, so there's a question from Rosalind Cerudis. I guess this is a question for anyone, including students, but what do you do if the microaggressor is a senior/supervisor and or counters with the fact that you read too much into the comment, or you are being overly sensitive, or it wasn't meant that way?
That's kind of a common pushback when someone gets that kind of feedback. I guess, and it's very tough, because the first thing the person is going to say is, you are being overly sensitive, and I'm in a role where I have to give you feedback about things, and that's just how it works out. But the whole question is, and we want to try to create a culture where that becomes acceptable. How would you want me to give you feedback? So if I'm working in a small group and I've got people that I'm responsible for, they need to be able to give me feedback about how they're experiencing me. So I'm going to ask, or I'm going to tell them, if you want to give me feedback about your experiences, this is how you would do this. So that's changing the culture, making it more conducive to where that kind of exchange can take place. And I think that that's one way, but it's a very difficult challenge because of what the questioner was asking about, having the person push back and say, well, you're just too sensitive, you're overreacting. Those are common sort of pushback remarks whenever someone comes forward and offers some feedback about something that they're experiencing.
Okay. So Tree Townley asks, how essential is it to create a culture of trust so that you can safely use this tool?
Tree is, as you know, it's critical. And the question would be, how do you go about doing that? Well, I mentioned earlier that microaggressions are most commonly experienced, at least in a medical setting, in meetings, okay? So if there is some meeting, a structured meeting that's set up, build into that meeting an opportunity to talk about issues of trust and ability to kind of give feedback in the process. And so over time, you start building the culture where it happens. Trust starts developing. Trust doesn't happen instantly. It happens because you become very intentional about building it in. I want to be in an environment where people can feel comfortable approaching me and saying, hey, Ron, you know, my experience in this situation was this with you. I want to be in a position where I want to hear that. I may not find it completely likable for me myself in that moment, but nonetheless, I want to be responsive under those circumstances, and it takes time. So building into meetings opportunities to talk about trust becomes one way of shifting the culture in a direction where trust is embedded within the institution as a whole.
Couple more questions on chat. This relates to culture as well. Is this something we should be teaching our elementary school teachers? A question from Shashi Bacha.
Dr. Badia, yes, I think that it should be. I worked as a mental health consultant in the San Diego City School District for about 11 years, and I worked with a model. It's called the Comer model. It's a national model that is used for working with mental health issues. And embedded within that model is this concept of no fault and communication and community engagement. So absolutely, and students can be taught that as well, as a way of sort of learning how to kind of engage their environment and confront the things that they have to confront. But yes, I would very much welcome the use of this approach in our schools, because that's how you develop the kind of culture you want. You start very young and you move from there.
There's a question from Ankita Anakal. Its question is, if you encounter microaggressions during an interaction with a patient, do you confront them with, this is an example of a microaggression, or is there a different way to balance standing up for yourself with patient care and maintaining professionalism?
It's a tough challenge, I think, and you have to be comfortable with the words that you use on those circumstances. Let me just stop you right there. Okay, because what you said or did is inappropriate, and we don't do that here. Okay, so if I'm going to provide care to you, this is what needs to happen. So it's okay, I think, to do that, even though you might be rattled on the circumstances. So the way to confront it is to confront it immediately in a very professional way. Draw the line in the sand and say, where are the barriers? What you're doing is unacceptable. If you want to receive care, this is what you need to do, particularly if the patient is being racist or sexist in some way. We get, I unfortunately serve on a committee that hears all of the change of provider requests in the VA, and sometimes requests will come through. The patient will say something to the effect of, I don't want to work with Dr. So-and-so, and I want an American doctor, or I want this kind of doctor. We don't assign providers on the basis of that. So that's the communication back to that patient. So that's something that needs to be worked out between them and the provider, but it is something that you would confront immediately.
Do we have any questions from someone in the audience that doesn't have access to chat? Okay, so I'm going to move back to the chat, Ron. You're accruing questions continually.
Oh my goodness.
So here you go. So this is from Zoe McAleese. It says, often folks who want to increase their awareness of their own biases get stuck in that discovery phase, unsure of how to change their behaviors. How do we push beyond self-awareness to action in reducing our biases and the way that they impact others?
Wow, that's a tough question. I guess I would wonder what I do to kind of immerse myself in different cultures. If you've had the opportunity to travel abroad or even lived in other countries for a period of time, it helps you to kind of gain the kind of insights about being the other when you're traveling or being in different cultures. So that's one thing that could be done. The other thing too, that there are coaches that are out there, life coaches sometimes that you can go and consult with, who have the expertise to kind of help people shape aspects of themselves. Reading helps sometimes, but I think for me, an experience in different cultures and different environments is also one way of sort of shifting some of those things and becoming very intentional about looking at some of these areas where there's some concerns about how you might be engaged or stuck in a particular situation, and getting past that stuckness.
So Arindam asks, do we have any good resources to learn more about preventing microaggressions in an organization and how to counter them?
Yes, I have some articles that I can put together and send to folks. If you just email me, I'd be glad to share some of those with you. And there's more than enough to kind of give you a good starting place for that.
So Emma Malloy asks, how can we approach a situation where we are not the target of the microaggression, but someone with us is? How can we stand up for them, but also avoid making the situation more uncomfortable for them?
In the moment, it might be more, without having to kind of read what's going on in this situation, but in the moment, it might be too difficult to do that because of what's occurring in that situation. So you're almost using your instincts to say that this is not probably the best time to do this. But later on, I certainly would reach, and I have done this before, reach out to that individual and let them know that you saw what was happening and that you felt concerned about them. And because you also want them to know that they do have support, and what can you do to help them under those circumstances, because that individual may be reluctant to accept that help in the situation. So talking with them later on might be one way of getting some insights from them, and also letting them know that you are supportive of them.
So Ron, I had a question about your Jari window.
Okay.
So if you're in that box of unknown, which is not known to self or not known to others, how do you proceed if you're looking to change or improve?
A lot more conversation connected with this, but what happens over time is that those unknown areas, if it's done correctly, move into the secret area. So on some level, you gain some insight because I'm aware I was in this situation. I didn't know this. I got in this situation and I had these reactions to this situation emotionally, and I didn't know that I would be reacting this way. And then now I'm aware of this, but I'm embarrassed about disclosing my reactions in this situation, so I keep it secret. So sometimes things occur that bring things to your awareness that weren't there before. They get moved into the secret area, but now there's a secret. And I don't want to talk about this too loudly because I might garner some resentment, but I know that that's true for me. And I'm trying to figure out a way to kind of grapple with it in some way, but it's a secret. So the unknown becomes more into the secret area over time through exposure to various situations over time. It is a challenge though, because you don't know it, but then all of a sudden, and I've had this happen to myself, I'm shocked at my reaction to something. I'm embarrassed by my being shocked. And then I'm trying to grapple with, well, what's the best way to deal with this secret? And I might keep that secret for a long time because I'm too ashamed to admit that I reacted this way to this situation. And I'm trying to figure out what's the best way for me to disclose this or cope with it in some way.
Do we have any other questions for Dr. Johnson? Okay. Thank you for a great talk and answering all those questions, Ron.
Thank you very much, Michael. Thank you very much, everyone. If you have any questions or anything you want me to send you, please just send me an email. I'm glad to support you. Thank you very much.
Thanks, Ron.
Bye-bye. Thank you, Michael.